for you all today. This is co-sponsored by ACRO and ROVER. This is building the foundation for radiation oncology medical student and intern success. And we have some phenomenal speakers here to offer up their advice and tips and tricks to help you guys succeed in your medical education journey. My name is Dr. Mimi Lane, and I am one of the resident moderators for this session. And then I have a co-moderator, Dr. Eileen Samuel, who's here as well. And so I'll go ahead and introduce briefly our speakers. They'll be introducing themselves again when it's their session. But the first half, which will take about 30 minutes, is going to be how to be a good rotating medical student. And we have two phenomenal attending physicians that are going to be presenting for that half. We have Dr. Trudy Wu and Dr. Ryan Hutton. And then the second half is going to be how to be a good intern. And we have two amazing resident physicians who are going to be offering their advice. We have Dr. Veronia Famey and Dr. Claudia Reed. So we have some amazing people that are going to be talking here today and really excited to share their advice with you guys. And then this is just me, and then Eileen Samuel. I'm a PGY 3 at UCLA, and then Eileen Samuel is a PGY 3 at Roswell Park. And during the session today, feel free to put any questions in the chat, and we appreciate the questions from the sign-up sheet as well. I'm hoping all of those are going to be addressed, and if not, we will be addressing the questions in a Q&A at the halfway point and also at the end. So without further ado, I will be turning this over to Dr. Trudy Wu and Dr. Ryan Hutton.
All right. Thank you. I think my part is first, so we can go ahead to the next slide. So as Mimi said, I'm Dr. Ryan Hutton. I am an attending physician at the University of Wisconsin-Madison, and I'll be talking about some of the kind of logistics of medical school rotations and kind of some just tips and tricks for how to succeed on those rotations. So we can go ahead there. So there's several goals for fourth year medical student rotations, and it's kind of unique from the rest of medical school. So I thought it was worthwhile to kind of just start there with, what are you hoping to gain from spending time in rotating through departments that you are considering for residency in radiation oncology. So kind of first and foremost, and I think most obviously, it is an audition of sorts. It's a prolonged interview. You're trying to make a good impression on all the faculty, on all the residents. And the way to do that is really to make sure you have clear expectations for what is expected of you. And you want to understand kind of from the get-go what your daily schedule is going to be. And there's a lot of good pearls throughout this presentation about how to prepare and ways to really succeed at that. Go ahead. So the other kind of maybe less obvious goals are you're trying to get a feel for the department that you're rotating in. And so, you may have a good sense of what your home institution's department is if you have one, but when you do away rotations, it may be totally different. The interdepartmental vibe may feel very different than what you were expecting. And so getting a sense of that is a huge benefit of doing away rotations, and you get a much better feel for that sort of thing spending a few weeks with a department rather than just an interview day. And so you want to kind of understand, how do residents interact with each other, how do they interact with faculty, how does the rest of the department seem to interact with trainees. And then a critical part of your application is getting letters of recommendation. And so you're going to want to kind of keep that in the back of your mind and identify faculty that you think will kind of be in your corner as you go ahead with applications. And so we'll talk a little bit more about that as well. You can go ahead. Yeah, and then probably even more important, I would just add is, like, you want to figure out if you'd even like living in the area you are, if you're doing away rotations. And, a lot of us look at big moves across the country potentially for residency. And so doing away rotations lets you kind of try on different cities, different communities, and make sure you actually would enjoy your time when you're not working. So those are the kind of four goals that I would point you to. Next slide. Yeah, so how do you set expectations for a medical school rotation? It's kind of hard because you just show up on, day one, and a lot of times the clinic is busy. There's chaos just kind of unfolding as is naturally in any clinic anywhere. But there should be kind of right off the bat a point person that kind of puts you through a brief orientation. It's often a chief resident. Sometimes there's a program coordinator that's more of like an administrative support person. And between those two, you should have a pretty clear schedule outlined in terms of, who you're with, what day, what sort of hours you'll be expected to be there. You can advance the slide here to fill in the rest. So, different departments structure this differently. I think it's most common that you kind of bounce around between a different faculty member each day of the week, so you get a better feel of all the different varying things that are done in the department. That's great to get a feel for things, but it makes it challenging to, make strong impressions and get to know people well, because you may only have one or two chances to work with a particular faculty in a 1 month rotation. So some obvious things to just make sure on away rotations. When should you get there? In the morning is a big one. If you're constantly there later than expected, it just looks bad. So make sure you know that. And then sometimes it's not laid out that clear, but what are the meetings that would be of value for you to go to? And that's usually going to chart rounds, which is often weekly in departments. If there's tumor boards going on, in the mornings or at lunchtime that you're interested in, how do you participate in those? And then make sure you know when all the resident lectures are for the entire time you're there, because you should plan on attending those. Go ahead. And then a lot of departments have resident or medical students rotate through to give end of rotation presentation, and that is often something where they want to just get you to kind of synthesize something you learned on the department and give a clinical talk. Sometimes there's an opportunity to show off some of the research that you've done, and so finding out early in your time in a department, if you are expected to give a talk, what are the reasonable topics that would help you with that. And chief residents or anybody can really help guide you with that. But just something to be aware of early rather than blindsided by that, in the fourth week of your rotation. Go ahead. So I think first and foremost, when you're doing these rotations, you want to impress in the clinic. You want to show that you can take good patient care. You want to show that you can be thoughtful about, guiding a patient through treatment. And so this is kind of a framework that I think is helpful. Three components: you need to prepare, you need to, be active in the patient visit, and then you need to be able to synthesize that into a presentation with the rest of the team. So um, go ahead. So preparing for a patient, Dr. Wu's part of this talk is going to give you just incredible resources that are, freely available for how to, do research on different cancer things. But this is a good kind of framework for what to do. You should ahead of time look at a clinic schedule, pick out what patients you're going to be seeing with what faculty, and you want to kind of ahead of time organize your thoughts. So go through the patient's diagnosis, their history, look at imaging, look at their pathology results, and then try to figure out what stage is that patient based on their cancer diagnosis. What are the standard of care treatments? How does radiation fit into that? And then kind of bonus points would be, are there clinical trials out there that support the standard of care? Why is that a standard treatment recommendation? Start asking yourself every time you're preparing for a patient, like, why is this patient being recommended radiation? Why is this patient being recommended chemotherapy and radiation? Why is this patient, a suitable patient to maybe do no treatment right now? And so start kind of asking yourself why, and then that's a good way to kind of guide how you're reading up on these scenarios. So then when you go to the actual clinic visit, a lot of times medical students are going in prior to the rest of the team and getting to kind of do the initial component of the clinic visit. That includes, reviewing their history. This is kind of the basic med school H&P that you guys have all been, working on throughout your clinical years, but you want to keep it focused. And for oncology, that has everything to do with what type of cancer you're seeing. You want to find out what symptoms the cancer is causing, if any. You want to know how it's affecting their patient. You want to get a sense of how healthy they are overall. And all of that information is important because it might take treatment options on or off the table for the patient. And then, as you get more comfortable with radiation oncology clinic, there is potentially an option that you can start kind of discussing actual radiation details with patients. But I think for most clinical rotations as a medical student, you're really doing more of the information gathering and deferring that counseling part to the residents and the faculty. And part of that's because you don't want to, misspeak and because that can be a bad situation, but also you probably only have a 60-minute clinic encounter and you want to give time for the residents and the faculty to kind of weigh in on all that. So really how you succeed is that information gathering part for the patient visit. And then presentations are very stressful, I would say, as like a medical student. I still remember kind of like quivering and being like, oh my God, how do I get all this detail into, one sentence? It's a really hard skill to develop. And so working on it early is super helpful and figure out, the order of the words that you want to say. So this patient is, 65 years old. They have a stage 2 lung cancer. This is the diagnosis, the test they've been through. This is how we know they're not metastatic. And this is what, their current symptoms are. And so that one-liner is kind of the critical piece of all this. I think it's less common, at least in all the departments I've been in, that you're expected to give like a full formal presentation, on every patient you see. You might be given the opportunity to do that once or twice, but really it's like stick with the pertinence, synthesize it into a brief little statement, and then talk about what treatment options are on the table. And then that gives the resident and the faculty an opportunity to kind of have a discussion with you about the radiation specifics, and that's a nice way to kind of learn on the fly. Um, if you are asked to give a formal presentation, the way I like to keep it is like, even though you're covering all of this information, you want to keep it less than 5 minutes. You're not going to be expected to spend 20 minutes going through, every little detail of a patient's history. You really want to keep things tight and focused. And so that's the skill that, it takes years to figure that out. And there's, residents that are still honing that. There's faculty that are still honing that. So, but that's a good thing to work towards. Next slide. So the medical student H&P, like I was saying, the clinic visit is usually 60 minutes in radiation oncology, at least, that's how it's scheduled in the EMR. Patients are often there much longer than 60 minutes, depending on, uh, the clinic. However, you don't want to take up the whole 60 minutes as a medical student with the patient. They don't want to spend 60 minutes with a medical student and then 60 more minutes with a resident and 60 more minutes with faculty. So really you want to aim to take 20 minutes or so with the patient, get to know them, get a sense of what they're dealing with, plan to spend 5 or 10 minutes talking to the attending after you've seen the patient. And then ideally, you get to witness the rest of the visit, go back in with the attending, hear how they talk to patients, hear how they counsel patients about everything to expect. And you can learn a ton from that back half of the visit, just by listening. If you get behind in clinic, often then you're asked to just go do the history on the next patient, and you miss out on that, learning from the faculty and how they teach their patients about their diagnosis and their treatment options. So I think that's really valuable to try uh, to preserve when you can. Quick shout out to Dr. Zorsky, who is just a wealth of incredible information on Twitter, YouTube. He's got a website that we can probably link to, but he has this nice little here's how to do a H&P and radiation oncology document, and he has like a Twitter post I just screen grabbed there about it, but that's a good thing to maybe just print out and have on your rotations just to guide you if you're kind of worried about how to keep things focused for Rad-Onc Clinic. Next slide. So, of course, consults is kind of the bread and butter of like a radiation oncology rotation. However, there's so much else that's going on in Rad-Onc Clinic, and you do want to get a sense of this too, especially if you're trying to figure out if rad-onc is right for you, or if you want to kind of figure out like, does this department have a particular strength in procedures like brachytherapy, or, are there other things going on in the department that, would sway your enthusiasm to go there? And so things to try to get involved with if and when you can on your student rotations. Try to see as many procedures as you can. It's a nice opportunity to see like a different side of rad-onc than maybe you have. And it also gives you some time, like potentially more time with a particular faculty member where, you're in a room, you're doing a procedure with a patient, but there's an opportunity to get to know faculty better during procedures, especially like uh, I do prostate brachytherapy. And so that's potentially a couple hours that you could spend with a faculty member and really learn more about the department as that's going on. And then the other parts of, you know, radiation treatment planning, contouring, evaluating plans, going to see a CT sim if you've never seen that, getting to know the therapists, that are delivering the treatment. These are all things that might help with your sense of like a department culture. And then reviewing cases, if there's time at the end of the day, if there's time at the end of a week to kind of go back and say, hey, whatever happened with that inpatient we saw on Monday, and kind of like trying to synthesize things and piece together, the actual patient care journey. I think that's helpful. And then, there's always research opportunities in any of these academic departments you rotate through. And if that's something you're interested in, asking about that early, and, there's a chance you could collaborate with a resident that just needs a little help with a lit review, or, a case report that's just been sitting on someone's back burner. And it's pretty easy to get involved in that if you so desire. And that strengthens your application that way too. Next slide. So getting letters of recommendation, that's another thing that's just challenging. It's stressful. Like I was saying earlier, you kind of want to know early in the rotation if you're going to ask a faculty member, and there's often flexibility to try to work with them, maybe a couple extra days, if there's something in particular you're looking for. You can base that off, shared research interests, particular disease site you're more interested in. Often it's just, someone you had a good day with early in the rotation, and you want to circle back with them and just solidify that, you're a good medical student and they think so too. Um, in my opinion, and this is definitely my opinion, but I think getting a strong letter from someone you spend more time with, even if they're not quote unquote a big name in the field, is a lot more valuable than getting, a department chair to write you a letter that maybe, attended a talk you gave but didn't work with you in clinic. When we're reviewing applications for residency, we see a lot of generic letters. And so if you can get one that has a little more heft behind it, that goes a long way. Uh, all right, I'm going to hand it over to Dr. Wu for the rest of this, and then we'll do the Q&A.
Your prior slide reminded me about when I was a med student doing an OA. I contoured a kidney, and I thought I was like the coolest person on the face of the earth because I was like, look at me contouring the kidney. It also took me like 2 hours, but all right. So I'm Trudy Wu. I am an associate program director at UCLA, and I'm also the medical student clerkship director. Um, Entering radiation oncology is kind of like starting med school over a little bit because you're learning so many new concepts and so many new topics. But the good thing is that we have a lot of resources that are here that you can, learn from. So the first one, so we're just going to go through some resources I think are great. I hate reading books and I kind of like browse through these books, but the Red Book is actually one for someone who does not like reading books that everyone, I think every radiation oncology resident should at least have. There's a second edition that came out a few years ago, but it's very high yield. It's divided into different disease sites for each disease, and it goes through workup, diagnostic studies, treatment planning, and then at the very end for each disease, there is a list of all the high yield studies that support the data for that. So this is like, I think what many radiation oncology residents will consider the like a Bible because you will always be reviewing it and it's really great. So I think of all of these books, the red book is probably the best one. And it's all clinical. The green book is also clinical. I use this for written boards, which are the boards you'll take your PGY 5 year, but it's all question and it's Q&A format, and it also goes through each disease site. So this one's also very good. And then the blue book is our physics and radiobiology book. So this is something that you can also browse and read if you learn best from reading books for your rad bio physics lectures. I mean, for your board exams that you'll take your PGY 4 year. Okay, RadOnc Review is lovely. I don't know how many people on here have used RadOnc Review, but it is essentially a giant Google Doc that is organized into very well organized. And I think it's like all the information you'll ever need. I use it a lot. Well, before open evidence, I would use it a lot to do literature research prior to writing papers. And it's really fantastic. Every single thing you can click on the different subtitles and it will just take you to where in the Google Doc you would want to review that information. And we'll click through it later after these slides are done. But this is a great site to bookmark. So RadOnc Review. NCCN guidelines, this is something that is really going to help you on your rotations because when you are proposing a treatment plan, this is a great way for you to go through the different branch points and decide what you're going to propose to your resident and your attending. It's free. You just have to create an account, and this is something that you will continue to pull up even when you're an attending. I use it every single day. eContour is a wonderful site to help you understand how to contour for specific cases. And this is also free. You create an account and you have access to all these cases. And I use this regularly. In addition to target delineation, it can also help you delineate OAR. So this is great because, especially in the head and neck region, they're able to help you contour what the relevant OARs are there. And that typically is one of the harder anatomic sites. So eContour is also a site you would want to bookmark. ArrowCase is great. So these are PDFs of cases that faculty and residents worked on and also free. We'll look at it in a little bit together, but usually what you can do is if you have a similar case in clinic, you can see if there's an ArrowCase that matches it and it goes through the workup, the treatment planning, and the data. And there are many cases that you can review. So ArrowCase is another site. Okay, lectures. So Dan Golden, when I think he was a resident, I'm not actually entirely sure in what part of his training he was, but he created these seminar series on YouTube, which I watched as a medical student. It's 3 lectures, and they're absolutely fantastic. So these are lectures that you're probably going to want to watch before you start your rotations. And it goes through everything clinical. He also touches on the basics of rad bio and physics. And it doesn't get too nitty gritty, which is great for medical school level learning. So these are on YouTube and you can copy and paste that link and access them. There are also these IROC videos, which are available on YouTube, which are also very great. We actually use part of this in our curriculum for residents in the very beginning when they first start out with residency, but you can see there are different topics that there are specific videos dedicated to simulation, contouring, plan eval. So these may be a little more advanced, but if you feel like you're craving more information and you want to learn more information on these specific topics, this is a good site to also visit. RadOnc Talks is newer. I personally haven't watched these because I was a little bit out of my training period when these started becoming very popular. But these are on YouTube, and I believe they are, about an hour long lecture about different disease sites, and actually created by a resident, I think, at Pittsburgh. And a lot of medical students and residents use these lectures in preparation for clinic to supplement their didactics at their individual residency training programs, and also to help study before board exams, so clinical and written boards, clinical and oral boards. So those are free on YouTube. There are all these lovely past Rover sessions that you have access to if you just look at the website. So that's also a very good resource right there. So shameless plug, this is a podcast that Josh, Noah, and I host, and they are all case-based, very short, 10 to 15 minutes, mock oral board style, maybe a little more advanced for a medical student, but helpful to kind of understand what we do and how we treat specific disease sites. So this is available on Apple or Spotify. And there's also this other podcast, which is on the newer side. I think a resident at Stanford created this. It's all AI generated, which is pretty cool. I think the voices are all AI and also discuss each individual disease site too from a rat-onc lens. So when I was a med student and I was like hungry for a rat-onc podcast, I was listening to the Curbsiders. I was listening to Behind the Knife, which is a surgery podcast. And I was just weeding through all the different episodes, trying to find the relevant like cancer related ones. So now it's wonderful because what, 5, 6, 7 years later, we have all these new podcasts that you guys can use as resources to study from. Okay, just some other things. The MedNet, this is great. I think this is maybe a little more high level. I mean, when I was a resident, I didn't even really use this, but I use it a lot now as an attending. But it's a forum for more practical questions. There are RTOG contouring atlas, which you can look at. There's this this website where you can go through and understand anatomy better if you are trying to contour a case. But I think e-contour should be sufficient. Like, I don't think you guys will need to buy a subscription to this website. Rat-onc Tables is a Google Doc, I believe, with a bunch of different trials. And if you so feel inclined to learn more about physics as a medical student, there are Eric Ford videos and there are also these high-fi physics videos available on YouTube if you are super interested in learning physics. And there are also Astro Journals podcasts where I think these discuss more not learning in terms of like workup and treatment planning, but more so discussing recent trials and recent data that come out, also available as a podcast. Okay. Oh, I totally forgot, Mimi. I told you I was going to start sharing my screen, but
That's okay. Do you want to take over now?
Yeah, real fast. Okay, so these are the 4 websites that I had discussed. This is Rat-onc Review. So let's say, for example, I want to learn about, I don't know, the treatment planning in rectal cancer. So I click on GI, and then it opens this Google Doc, and then it's nicely organized. I see table of contents right here, and it's nicely organized as all of these different disease sites. So then I would go to, where is it? Colorectal cancer, and I would click on treatment planning. So you click on this link if it loads. And then this is all the information on treatment planning. It's very succinct. There's not a lot of verbiage, which is great. And the best part is that if you want to, and it will reference trials. So if you want to learn more about short course, then you can click on this link right here, which was one of the trials, to get directed to that paper in PubMed. And some other things, like it also has information for follow-up, future direction. So this is a gold mine. Like, I think that I hope every resident knows about Rat-onc Review. So it's ratoncreview.org, and they have this for every single disease site, plus constraints, which is amazing. So you can come here, site-specific filters if you want to learn about constraints. And then they will give you constraints, and they'll also give you which trial and which guidelines these constraints are taken from. So you would look at how many fractions this patient's getting, and then base it off of, you would look through this table. So that is Rat-onc Review. NCCN. So you create your account, you go into guidelines, you go to treatment by cancer type, and then here I'm just going to click on colon cancer. And you click on this NCCN guidelines PDF. And similar to RadOnc Review, it will pull up this PDF and you can also click through. So the nice thing about these guidelines is that for each disease, they have a basically like some script and text at the very end where you can learn more about that specific type of cancer. But these are all links you can click on. So here's the workup. This is everything you need to include in a workup. If it's, microsatellite stable, if there's a mutation, you click on this link and it kind of takes you through all these treatment paradigms, tells you which treatments are NCCN recommended, which is kind of like the gold standard and how we manage patients. So this is really good, especially when you're proposing treatment recommendations in clinic. E-contour, so go to GI, you click on your site, and here, there on the left side, you can show your different OARs. You can turn them off. You can turn on your targets. You can just look at your specific CTVs. Here it tells you about the prescription, contours, and treatment pearls. So this is good from a treatment planning perspective. And a lot of these, you can look at the fusion if there is a fusion. I don't think this one does. And then arrow case, finally, very quickly. If you just click on like GI tract, these are all the different arrow cases that have been created in the past that you can review. And there are PDFs, and it will go through a clinical case. So these are also a great way to learn. So that's it.
Thank you. Let me take over sharing again. Well, thank you, Dr. Wu and Dr. Hutton. That was some phenomenal advice. I think we have time for maybe one question in the Q&A, and I appreciate all the questions in the chat. I think Eileen Samuel was able to answer most of them, and this session will be recorded and posted online, so you can always refer back to these slides. I think one question also, kind of looking at some of the questions that people submitted when they signed up for the session. Are there any common mistakes that you see people make when they're on maybe a visiting or away rotation? Maybe that's something you'd recommend people avoid doing? Anything for people to keep in mind?
I feel like I wouldn't say common mistake, but like the switch from being a third year med student to like a fourth year interviewing med student, like you want to try to have a little more active participation. So not just kind of sitting in the corner watching a resident do something, like try to get your hands dirty, uh, stepping in, uh, kind of like I was outlining, like more like play a role in the patient visit, if they give you a room to. And then I think just one thing that sometimes med students prepare so well that they do feel like they know, oh, this patient has a glioblastoma, they're going to receive 30 treatments, or something like that. That may not be the institutional practice for a glioblastoma because XYZ. So just be careful about like sharing details with the patient you haven't confirmed with the resident or the doctor, because then you start looking a little bit uh, less confident, or you can confuse the patient and that causes stress for everybody. So, but that just comes back to communication with the residents and the faculty you're working with. Those are the two things that came to mind for me.
Yeah, I totally agree with that. I think especially when you go to a new institution, it's new faces, you don't know anybody, just sit down with the clerkship director or one of the program directors and just make sure you understand what your role is and what the expectations are, right? Because there are certain rotations at institutions where there may be more of an observership role. But if you are someone who's very proactive and this is like your audition for matching at this program, then what I would do is really adopt the role of the resident. So once you become more comfortable with radiation oncology, and let's say it's your third rotation and you really want a letter from this place, I would even say maybe try to find an attending who is not covered and really play the role of resident. This is your time to show off, right? Like go see every single patient, try to pen some orders, try to put in CT sims, ask the residents to show you how to put in a CT sim so that when you interview, you can be like, oh, I've had experience putting in a CT sim, stuff like that. So if you feel comfortable and you very much want to be proactive and you want to show off, then that is my suggestion. Because we've had medical students who've rotated through who are, operating at PGY2, PGY3 level, and I've been so incredibly impressed. So make sure you take those opportunities to show off your skills, which I'm sure many of you have, or if not all.
Thank you so much. Thank you again, Dr. Wu and Dr. Hutton. Amazing advice for all of our students. And now I would like to turn this over to two fantastic residents who are now going to be offering up advice for intern year. So kind of shifting gears now, moving ahead a year. Dr. Veronia Fahmy will be starting us off, followed by Dr. Claudia Reed. Veronia, if you'd like to take it away.
All right. Hi, everyone. I'm Veronia. Can you hear me okay?
Yes, we
So,
can.
I'm a current second year PGY2 resident at Loyola, Chicago. And I feel obligated to kind of, give a plug and a shout out to Dr. Trudy Wu because I recall when I was a medical student doing my auditions for RADONC, I would always put her, like I would always have her on Spotify and kind of like, listen in on all the podcasts. So that really, benefited me. And so thank you for that.
You're probably so sick of hearing my voice.
No, I was just kind of joking with all the residents. I was like, oh my God, I'm so starstruck. I can't believe I'm joining, this this talk with the Trudy Woo. So
Sweet.
yeah, Trudy and Josh, right? Well, I'm honored to be here. So let's get started. So this is my little, survival guide to TY or prelim year. So I did TY year, and actually I don't have access to the slides. So if you guys could, okay, that would be great. So I did TY year in New Jersey because I basically grew up in Jersey after doing med school in NICOM on Long Island, New York. But you do have the option to do either a prelim or a transitional year. Next slide, please. And basically, in my opinion, transitional years are more kind of laid out with rotations, so you get a little bit more flexibility. So let's say you're not, too keen on internal medicine like floors and ICU, and you want a little bit of flexibility and variety in the kind of rotations you do, then you might want to consider a transitional year over a medicine prelim or a surgical prelim. For TY, you rotate through everything. So floors, ICU, more floors, but during, the night hours, so called nights. And you also get electives kind of depending on, the specialties available at the program. So I assume everyone here wants to, go into RADONC. So I was lucky that my TY program in South Jersey had a radiation oncology program, not a residency program, but a radiation oncology service. So that was great there. But if not, then you could consider doing like, radiology or just kind of rotating through the oncology services, whether surgical or medical. Those would all be helpful. And basically a prelim or a TY year, it's your chance to, practice the practicality of medicine. So now you have all this knowledge that, will kind of transform into something bigger the more you see patients in real life and start to look into, guidelines and apply that to practice. But then you work out, workflows and how to communicate with the rest of the team and how to be on top of things. But also, it's a chance to study for boards. So after you graduate medical school, you would have had hopefully the chance to pass step 1 and step 2 or COMLEX level 1 and 2 if you're a DO. And then you're supposed to take step 3 or level 3 sometime during that prelim or transitional year. So really try to use the time wisely to study and prep for boards. So I found nights to be very useful for that. So how do you become a successful transitional year or prelim, PGY1? So this advice was given to me by one of the doctors I met during TY year, the 3 A's. So first and most important A is availability. So you have to show up to work. And the second one is affability, meaning how likable you are. And the third one is ability. And oftentimes, if you have the first two, if you're available and you're likable and you're good to work with people, people will assume the third. And people understand that you just came out of med school. You're not quite a doctor, even though you have the MD or DO next to your name. So, but you kind of have to, do the things that you're capable of doing, such as showing up to work and being a nice coworker to work with. And that's not just for co-residents or attendings, but that applies to the other members of the team. Right. So let's kind of break this down. So what does availability actually mean? It means that you show up to work early. 15 minutes is a good rule of thumb, especially if you're on the rotations with the floors or the ICU. People kind of want to start sign out right on the dot because the people that were covering the earlier shift also want to go home. So if you show up 15 minutes early, you're able to kind of log into the computer, get your patient list on, look quickly into the events from the overnight, look through Epic chats, all those good things that you'll be familiar with when you join residency. And it also shows that you're reliable and that you care. But besides showing up early, you kind of have to always be present and engaged. So during rounds, don't feel like, oh, because there's a senior, you can't talk, especially when it's about your patients. So you really have to be brave enough to speak up, and if there's something that you read up on or you feel like might be useful to the patient, have the courage to actually share that. It's okay. Again, we understand that you're learning anyway. In fact, I feel like attendings would appreciate the effort that you're trying to pitch in what you know and trying to help in every way possible. Also, on the note of availability, try to be very prompt when you answer like Epic chat or texts from coworkers. And the benefit of that also is that you don't forget about them, because the worst thing would be that you forget about a page and then 3 hours later you realize that, oh shoot, you left for the shift, but you're supposed to see this patient for an eventful event. So make sure that you're always staying on top of things by staying consistent with the things that you need to address, and follow through on tasks, give good sign out, but also after you round, make sure that you kind of run the list with the senior. Make sure that everyone's on the same page so that nothing gets lost through the cracks. Next slide, please. Affability. So I feel like when you go into medicine, we all inherently kind of have to be nice, right? Because you're helping patients. We all entered this career so that we could have a meaning to our career and kind of use our knowledge and our training to help through every way possible. But also residency, I feel like, is the time to put your pride on the side and to not be like the difficult resident. Difficult resident meaning, you only care about your PTO requests. You only want to give sign out give sign out first, for example, so that you could, finish your patients and dip. Or you don't necessarily finish tasks promptly, and then the senior has to always be the one following up, like, did you do this or that? So by being kind in your actions, you become likable. They like you, they want to work with you. And I also think that staying calm kind of goes under that category also. So for example, there's going to be times where you will be involved in rapid response. And as a transitional year or prelim, your role will oftentimes be like the chart checking or the ordering of things during the event while the senior actually, does the assessment. So it's important that you stay focused and calm and likable. So don't snap at nurses, or don't snap at your co-resident just because you feel stressed. So those are all, important things to keep in mind. Next slide, please. And then the last one, we already kind of agreed that, as a PGY1, your ability is not like 100%, but you're working on it. So what are some of the things that you can do though? So know your patients, meaning like actually do a good job in pre-charting, especially as you're starting. You want to give a good impression. Like you don't want to come off as the resident that is never prepared, because that will stick. And even if you continue to improve, some of the, like some of the attendings will kind of automatically just, blacklist you because you did not, show effort from day one. So try to really be prepared in that sense. Also be organized. So I already talked about like midday list checks with the senior, having like your own personal to-do list on your phone and kind of, deleting. Like for me, I have like a reminders, list on my iPhone, and as I'm done with a task, I just, remove it. Occasional swipes through Epic Chat to make sure that you're staying on top of things. And then always have a little goal for yourself. Maybe every day, but better off every week. So for instance, like if you felt like you weren't doing good on rounds, like you weren't answering questions correctly, really spend the time to go on UpToDate and look up the guidelines for that specific topic, and really do a good job studying it. Because when you realize that when you go into medicine or surgery as a PGY1, topics will repeat. Patients will keep coming in for the same things, like COPD exacerbation. That will be a lot. Acute heart failure on chronic. That will be, a ton. Asthma. So things like that you should be familiar with. Next slide, please. This goes without saying, being a team player. So the one thing I would highlight from the slide, just because we're running short on time, is the sick time and the calling out. So for instance, like if you're on nights, you know that if someone is on jeopardy, they'll have to come and cover you. If you have to really be sick to call out on nights, because people will dislike you for it, especially if you're on social media. Be careful, because you know there is a high chance that you'll get caught if you're lying, and it just wouldn't look good socially and professionally. Um, the other thing that you might encounter is like lists. So like oftentimes you'll be working with a co-resident that could be, an internal medicine resident or an actual categorical general surgery. The list is not always going to get divided fairly. Okay. So be flexible and understand that, if you take one or extra two patients today, maybe they'll do it, next time, and kind of be flexible in that, but also know your limits and be comfortable to speak up with the senior if there's something that is bothersome, or if you feel like things are not being consistently fair. Communicate that properly. Next slide, please. And then finally, stay open to learning. So residency is just an extension of medical school, and to be honest, I feel like even maybe the attendings on the call can attest to this. Even after they graduate, they still feel like there's more to learn and there's more to solidify. So and then furthermore, since you're all going to be hopefully matching into radiation oncology and going into a specialty, you're a doctor first. So everything that you learn from prelim and TY will serve you, ultimately. Like the other day, I was sitting in a coffee shop and some lady started seizing and fell and hit her head. And I was the only person there to kind of, intervene. And I felt super nervous because I was like, oh, shoot, I don't remember my stuff from TY. But, in the moment, it all comes back to you. So really try to cherish that time. Next slide, please. And this is a good one. Like really take this, time as a first year resident to build your reputation. You might think, you're just like a fly on the wall, but not really. People will remember you, and you don't know, who you're going to meet later in life. So, because medicine's a small world, so be sure that everything that you do it intentionally for the purpose of, being a good doctor, but also building a good reputation for yourself. Next slide, please. And use your time wisely. So again, this is just to reiterate, like, yes, TY is to get you to your specialty training, but also to pass your boards, because you don't want to be doing that PGY2 of, your specialty or rad-onc residency. Rad-onc is really tough to begin with. So you don't want to be focused on management of heart failure when you're supposed to be focused on like prostate cancer management. So really use the time wisely. And also, if you're going to be doing a prelim in medicine or a TY with medicine folks, they do mixed app review questions. So I feel like there's a lot of overlap between boards and mix-up. So, feel free to kind of pay attention to those when you listen in. Next slide, please. And keep a running, yeah, so those are kind of just last minute things. So you gotta keep a running task list always on your device, write things down during rounds, always read about your patients on UpToDate, and try not to take work home. Really cherish DY year to be, a good year to learn, but also to relax before the incoming storm of RADOX. So, try to use your time wisely there. Next slide, please. So finally, the takeaways, the 3 A's, really try to be available and show up to work and be likable, and people will hopefully assume your ability and continue to grow. Stay humble and teachable. Use your time well, take the time to build relationships, even if those people that you'll build relations with are, going to be transient and move away to their respective states and residencies, still cherish that time and continue to stay active and eat healthy. I gained a lot of weight during TY and I lost it all in Radon. So, always be mindful of your health first so that you can help other people, and try to do something fun every week. You got this. That was all.
Thank you so much. That was amazing, wonderful advice. And then leading up to that, Dr. Claudia Reed.
Hey y'all, my name is Claudia. I am finishing up my PGY1 intern year in internal medicine, and we'll be starting right on residency at UAB in a couple months. So I kind of wanted to use my couple minutes to talk just to focus on, how to become a good doctor intern year and how maybe that can help you with your radiation oncology training later on. So we can go to the next slide. So I just have to, this whole year I've been reminding myself like this is a year of foundational experience of becoming a doctor first before I become a specialist second. I feel like intern year has really helped me build clinical judgment, confidence in how to manage sick patients, and further develop my communication skills. We can go to the next slide. It's also important not to mentally check out during this year. Like Vernia said, every rotation has value, even the ones you don't love. I do with doing my prelim year in internal medicine, I'm on the medicine floors a lot. And so I've been able to see lots of complications of cancer, plus the treatments that are associated with them, and then also learn how to manage comorbidities that a lot of my future patients will have. And so I've really just, I think it's great to kind of have a mindset shift during this year. Like instead of, this heart failure exacerbation management doesn't apply to me, but this may help me take better care of my future patients. We kind of already talked about this, but just giving good effort always, being efficient will help you succeed in this year. So I feel like developing systems has helped me this year, like how I pre-chart each morning, how I prepare, how I prep my notes, kind of my workflow each day has really set me up for success this year. It's taken time. It's definitely, I'm faster in the mornings now, pre-charting and preparing for rounds than I was 6 months ago. But you'll learn to anticipate needs and learn how to prioritize things this year. Also, this year helps you build your clinical foundation. I've learned how, to interpret labs, interpret imaging, manage acute issues like electrolyte abnormalities, acute infections, pain, etc. And then just, being mindful, RADONC patients are typically medically complex. They have a lot of other comorbidities and have these side effects associated with radiation therapy. Also, radiation oncology patients are a lot of times admitted to the hospital. So you learn how to better understand their inpatient courses during this year. We've kind of hit the high points on this, but I feel like these are really good core skills to master during this year that will help you later on. Just learn how to be efficient using the EMR, how to manage your time wisely, prioritize things, communicate well with your patients, their families, your co-residents, specialists. And then I also feel like this year has also helped me learn how to have hard conversations with patients and their families. I feel like that's really important, especially in the field of medicine we're in, like having goals of care discussions, learn how to deliver difficult news. And then also you get procedural basics, even if it's limited. Always be a team player. I think we already hit on this. We can go to the next slide. And then I also feel like this year gives you a chance to network even like without trying, because I find myself, talking to specialists every single day, surgeons, pulmonologists, medical oncologists, rad-oncs. And so this is a great time just to, meet people, form those relationships, and that sort of thing. Intern year definitely gets hard. The hours are very long. There are tough rotations. Burnout happens. But I just find myself that I have to remind myself, this is temporary. This is for a year. This is helping me build resilience. And this is just a building block on helping me become a radiation oncologist, which is my end goal. Next slide. Thank you. And then these are just 5 practical tips that I feel like are simple things that have really made a difference this year. Like I mentioned earlier, learn how to prepare well, how kind of your um, framework of how to pre-chart, prep your notes, your discharge summaries, that sort of thing. Don't be afraid to ask questions. It's better to ask a question instead of doing something incorrectly that could have been avoided. No, you will make mistakes and have grace for yourself while you're still learning. Um, Also, follow up on everything, learn how to be detailed, be organized, and then also be kind to your patients and to yourself. And then this is just my take home message slide. You've already matched, you're becoming a doctor. This year is, just learning those excellent skills on how to become a doctor. And then you get to transition into learning how to become a specialist. Thank you.
Thank you both. Excellent advice for intern year. I think that's very practical. Just very, helpful day-to-day advice for a year that kind of flies by, honestly, in the grand scheme of things, but it's a very busy year for us. Um, I didn't see any questions in the chat, but kind of looking at the questions that, some people had put in when they signed up. I think this question is a little bit more maybe geared towards Veronia, but also Claudia. Um, I guess, Veronia, how was that transition for you going from PGY1 to PGY2? And then maybe Claudia, any specific things that you're doing to make that transition easier?
Yeah, sure, I can go first. So I think that PGY2 was, not the easiest thing, especially coming from TY. Like in my mind, I actually think that if I went from M4 to PGY2 straight up, I may have had an easier transition than the skip to TY and the break. Because, in M4, you kind of already in the groove of RADONC, you start to learn a little bit about NCCN, all the podcasts, maybe got your feet wet in the literature a little. Then you're like, okay, bye bye, Radonk. Time to do TY or prelim because it's part of the training. So it's okay though. I would say if I had to go back, I would maybe freshen up on my radiology knowledge during my free time in TY, because TY is not always like hard work. You get a little bit of elective time in between, so use that wisely to freshen up on radiology. Like Dr. Wu mentioned, eContour is a great resource. There's also like Radiopedia that you could look into. So I would say radiology is very important. The second thing is, if you are interested in a few topics, and that would actually connect with the next question about how to find research opportunities, kind of reach out to residents that you have worked with from your medical school, like audition rotations, and find the ones that are really productive in research, and just kind of say, hey, I really need to do research, I need to get it done, I need to start building my publication list, just consider me for every project. Keep your mind open, and because all oncology related anyway, and you're going to end up learning all the disease sites anyway, and that way you get a little bit of learning through like writing up an introduction section or discussion section, so it kind of all ties to your learning and building your foundation of radiation oncology knowledge to make that transition to PGY2 easier.
Yeah, I agree with all of that. I feel like the radiology thing, like I try to, review CT scans, MRIs of the patients I'm seeing on inpatient wards. Just, familiarize myself with anatomy, normal, abnormal things. I feel like that's been helpful. I took my complex level 3 exam in December. And so since January, I've tried to do, as long as I'm not exhausted, a little bit of like rad-onc prep, 10 to 15 minutes per day. So I have the red book that honestly just read. And then I listen to At the Beam a lot. And I am also doing a rad-onc rotation um, starting in about 2 weeks. So I scheduled it towards the end of my intern year so that I could, get a little refresher before starting PGY2. So if that's available to you, I think that will also be very helpful.
Thank you both. Such helpful advice. I think if we touch on just this one last question about communication resources, just because I feel like that is really important. And there are a lot of very difficult conversations that you're, going to be having with patients. And, practice doesn't make those things easy, but it makes those things easier. And I wonder maybe Dr. Wu or Dr. Hutton, if you know of any online resources, maybe there's any videos on YouTube. I know at UCLA we have like a difficult conversation seminar that we have. But there might be other resources available online, I think, that should be readily available.
This is a great question. I actually don't know the answer to this. I asked somebody, I just messaged somebody asking if they knew of any good resources, but I may have to get back to you on that. Unless Dr.
On
Hunt.
on RadOnc review on the palliative doc, there at the beginning, there's some like frameworks for like some of the things you learn in med school about like, disclosing a difficult thing and like communication frameworks that, it's kind of basic and I still think it comes down to practice. And one thing that I think Claudia brought up talking about prelim year, but if you have the opportunity to tag along with palliative care, or if you have dedicated oncology rotations where you're on wards with, critically ill cancer patients. I feel like I learned so much about just end of life communication and difficult, high risk sort of cancer discussions during my intern year just from being around that. So that's another huge just, it's heavy, it weighs on you. It's more intense than like the typical rad-onc clinic, but I think a lot of the skills transfer quite well to what we do every day.
Kind of same for surgery rotation. I don't know if this was mentioned, but if you have the opportunity and you have the bandwidth, spend some time with some of the surgical oncology services, because that's going to help you understand like what exactly is involved in a neck dissection, what happens in a Whipple, what is a positive margin, how are you going to treat that positive margin as a radiation oncologist. So that is a good opportunity to maybe just get a snapshot and spend a little bit of time with those services that will help you in the future, especially if, let's say, you're really interested in breast radiation oncology, then go observe some lumpectomy, see how they do the margins and they do the excisions, stuff like that.
Great advice. Appreciate that. And thank you to everyone, all four of our speakers, for just sharing their wealth of knowledge. And, this is a really exciting and important, but also can be kind of a scary transition time in your, medical school training. So, we all understand that, we've all either been there or you guys will be there. And you will get through it. You're going to be amazing and you're going to impress everyone. So, it's a very, exciting time of your life. So we're very happy for you all. Um, I think with that, we just have some closing slides here. So this is a little shout out for our upcoming session on June 5th. The registration link will be available sometime soon on the ROVER website. This is going to be AI and clinical workflow, and we have two fantastic speakers who will be talking with us about AI. And then this is a networking session. We had a lot of questions in the sign up form about how people can network with, current residents or attendings in radiation oncology. And so this is an excellent way to network with other people and kind of hear other advice and more of like a breakout room type style with different faculty and residents. And so that sign up sheet will be coming up soon, but this will be in September. And then lastly, Rover is this virtual education platform that hosts, educational videos and networking opportunities and other educational kind of online resources to help, make people understand a little bit more about radiation oncology and what's involved and the people involved. And so we are always looking for more people who are interested in joining. We usually have residents join us, residents or faculty. We do have some PGY1s that are on Rover. So even if you're an intern, definitely, if you feel like you have the bandwidth, feel free to join our group. And I will just leave this up here just so people could have this last slide. And again, this session is recorded. It will be posted on the Rover website and on YouTube. And so if anyone wants other contact info, I'm going to put my email in the chat. Feel free to email me. You can text me because I'm not always the best at checking my email. But I think kind of in general, we're always willing to share advice with people. So thank you all for coming and sharing your Friday with us. And we look forward to seeing you next time.
Thank you. Bye.